Welcome back. We'll be talking about the latest world news related to COVID 19. In Iran, the virus has killed 97 people, bringing the total deaths to 611. Iran is the worst country to be hit by the virus as there are 12,729 cases, including seniors, that are tested positive. It is a close ally of the Syrian government in the civil war, advising the military to restrict travel between the two countries. Health Minister Saeed Namaki said that Iran is making new restrictions to move into and out of cities. Iran also has closed schools and banned spectators from stadiums. However, religious shrines remain open and the markets.
So we have to remember Iran is a developing country, although actually the health sector, specifically the public health programs of Iran, are one of the best compared to many of its neighbors in its specific region. But at the end of the day, it's a developing country. There's limited capacity, and it seems like there's also a limited access or a lack of these test kits, which also led to the spread of the virus undetected. Add to that also the nature of the Iranian government, a lack of transparency. With this lack of capacity, is making this a lot bigger of a problem than in other countries. But at the end of the day, this is something that even a big country like China, with that economy and all of those resources, couldn't completely contain. And Iran is just, compared to any of those large economies, is much smaller with a lot less resources.
And so, any idea how many people actually have COVID-19 in Iran? Do you believe are the numbers correct that we're getting?
The official numbers that we're getting are much higher than what it's anticipated. Even some government officials, some health ministry officials actually did acknowledge that they're only announcing cases where the tests are positive and confirmed. But he also acknowledged that the actual number is probably higher than what they're announcing. BBC sources from inside the country, BBC has reported 210 deaths from the coronavirus from hospital sources in Iran. If we take that as a correct number, 200 deaths, and then assume the 2% mortality rate that scientists have declared for this virus, that means around 10,000 people could be having the virus at this point, but the official numbers that are coming are around 1,000. So it's much behind, probably due to a lack of transparency because the government wants to hide the gravity of this issue, but also due to a lack of test kits. It's just people are walking around with the virus not knowing that they have it just because they haven't been tested for it.
Okay. Now, both President Bush and after that, President Obama temporarily put sanctions aside when Iran had a devastating earthquake several years ago, but President Trump hasn't done that in this case. And do you expect that to change given that there's this public health emergency?
Well, it seems like President Trump's administration is taking a very hawkish stance, as you said, even compared to President Bush. They did um, basically ease a little bit of sanctions on Iran's central bank to allow for humanitarian transactions, but it's nothing compared to the previous administrations. Under President Bush, the BAM earthquake, the devastating earthquake, there were actually American military planes with American supplies and American personnel who flew into Iran to deliver aid. So this is nothing compared to that. This administration still has maintained its hawkish stance, and it seems like this is not only hurting the health of Iranians inside Iran, but because of the connectivity of today's world, the nature of our world, we're seeing cases popping up in New Zealand, in Lebanon, in the region, and all the way where you are in Canada.
In Rwanda, the country reported its first case of coronavirus. That case was an Indian citizen who arrived in the East African nation from Mumbai on March 8th. He had no symptoms when he arrived but presented his information to a health facility on March 13th. He is under treatment in stable condition from other patients. Rwanda is the first African country to report the virus, alongside Morocco, Tunisia, Egypt, Algeria, Senegal, Togo, Cameroon, Burkina Faso, Democratic Republic of the Congo, South Africa, Nigeria, Ivory Coast, Gabon, Ghana, Guinea, Sudan, Kenya, and Ethiopia. In Europe, France and Spain both have declared an emergency restriction due to the spread of COVID-19. France is shutting down all non-essential places by midnight after Prime Minister Edouard Philippe said that people who are in intensive care were growing, causing earlier guidelines to be ignored. The closure applies to restaurants, cafes, cinemas, and nightclubs, as well as non-essential businesses. Mr. Phillips said all essential businesses, such as food shops, chemists, banks, tobacco shops, and petrol stations, will not be affected. To slow down the epidemic, Mr. Phillip asked people to restrict travel into the country and will close schools on Monday until further notice. France reported a sharp rise in cases on Saturday from 3,661 to 4,499. It recorded 12 more deaths, bringing the toll to 79. Spain's Prime Minister Pedro Sanchez is banning Spanish citizens from leaving home, except for buying essential supplies and medicines or for work throughout the country. All museums, cultural centers, and sports venues will be closed. Restaurants and cafes may only do home deliveries. Essential services like banks and petrol stations will remain open. Schools are already shut down across the country. The emergency restriction will last for 2 weeks if the parliament approved it, since there are more than 1,800 cases by Friday evening.
The White House expanded its travel ban from European nations, adding Britain and Ireland to a list that now includes 28 nations. Americans are being allowed to return from Europe. And worldwide, more than 153,000 cases of the coronavirus are reported, at least 5,700 deaths, with Europe now the epicenter of the pandemic. Ian Lee in London has the latest.
Peter Miles in better times. Today, the 67-year-old is quarantined with the coronavirus. His daughter, actress Sophia Miles, has documented his decline.
My father is now locked in a ward, no visitors.
What have the doctors told you about his condition?
We keep getting calls saying he's imminently away from death, so I went the other day fully prepared to watch him die. I could tell that under the surface they are absolutely, freaking out. And I don't know how our medical system is going to be able to handle the influx of patients.
His is just one of hundreds of people in the UK who've contracted the virus. More than 20 have died. The royal family has limited official engagements and embraced the recommendations. Across Europe, cities have turned into ghost towns. Museums, monuments, and main squares deserted. Countries are closing their borders. Spain is going into lockdown as their death toll spikes, while Italy's prime minister called it their darkest hour. But from the gloom comes a tune, medicine for their hearts and souls. From Sicily to Siena, quarantined Italians sing songs of defiance. Even Iranian doctors and nurses dance to keep spirits high. The virus has devastated that country. The death toll is more than 500, but these satellite photos of mass graves show it could be much worse as the virus targets the most vulnerable.
What advice would you give Americans who are watching this who could be in a similar situation?
I would say be very mindful of your elderly relatives hanging out too close around them, or in fact even in their homes, and also anyone else that whose immune system is already down and vulnerable.
An international pandemic touching individual lives. Ian Lee, CBS News, London.
The number of people with coronavirus in Italy has risen to 20% in one day to 21,157. A further 175 had been killed by the airborne SARS-like disease in the past 24 hours, bringing the country's death toll to 1,441. A little more than half of those new cases occurred in the north region of Lombardy, which has been the worst affected area in Europe. The country has been put on lockdown with strict emergency measures in place to prevent the deadly bug's spread. Bars, restaurants, sports stadiums, schools, and cinemas had been shut down, and people who refuse to self-isolate knowing that they are infected with COVID-19 could face legal action. Italy is the worst hit country in Europe and in the world outside of China. Its death toll surged by 25% yesterday, the largest increase since the outbreak began.
All of Italy, a country of 60 million people, is now effectively a red zone. On Monday evening, Italian Prime Minister Giuseppe Conte the measures that had just been put in place on Sunday morning in the Lombardy region and 14 other provinces, an area with a population of around 16 million people, would be extended to the entire country. This means that schools and universities will be closed until at least the 3rd of April. All public and private sporting events canceled. All public gatherings banned. Only absolutely necessary travel between cities and provinces will be allowed. Now, what we heard also on Monday evening were the latest numbers when it comes to coronavirus cases. They jumped another 1,800 approximately, reaching 9,172 cases. 463 people have died from coronavirus. Now, these mounting numbers are putting ever greater pressure on Italy's public health system. CNN was able to speak to the coordinator for intensive care in the Lombardy region, who said that the public health system in that area, which is really one of the best public health systems in the entire country, is stepping towards collapse, that they are receiving, in his words, a tsunami of patients, and that intensive care is being provided in corridors of hospitals. I'm Ben Wiedemann, CNN, reporting from Bologna in northern Italy.
The Central African Republic on Saturday confirmed its first case of the coronavirus. This case was of a 74-year-old Italian who visited Milan and first presented symptoms on March 8th, one day after returning to the country, but health authorities were not alerted to his case until March 13th. US President Donald Trump was tested negative for the coronavirus. Trump said he was tested Friday night and said that his temperature was taken today before entering the White House meeting room. The president told reporters that his temperature was normal. The White House physician had previously said in a memo that the president's testing for COVID-19 is not displayed. Asked when he would announce the results of his coronavirus test, the president said that the test was sent to a lab and could take a day or two to receive the results. Trump said he took the test only because the press is going crazy.
Temperature taken coming into the room?
So did we.
You did? Good.
Yes, sir.
Let's compare. Do you want to compare?
We did all of us, yeah.
Good. Well, that means we're all looking good. I also took the test last night. Yeah. And I decided I should, based on the press conference yesterday. People were asking, did I take the test?
The result, Mr. President?
I don't know, whatever it takes, a day or 2 days, whatever it is. They send it to a lab.
Was your temperature normal, Mr. President?
Totally normal. Wasn't that what you did?
And finally, the Raptors players had been tested positive for COVID-19. This comes after being contracted for the Utah Jazz player Rudy Goldberg, who was tested positive for coronavirus. Donovan Mitchell, a teammate player, was the second player to be tested for the coronavirus. Toronto had faced Utah Jazz on Monday night, and both players played against the Raptors. With the Raptors being tested for the virus and the NBA season suspended, they will go into self-isolation.